There we go. Yeah, but it's not rewritable, so you can't use it again. That's why I stopped it immediately.
Oh, okay. Bientôt. Good evening. My name is Janine Uwimana. I'm from the School of Public Health at the University of Rwanda and the University of Western Cape, and I'm part of the Emerging Voices. So there is an initiative that young researchers from the globe has put in place, and it's called $1 campaign for Ebola. And the purpose for the campaign is to raise awareness about Ebola, but at the same time for fundraising, to get some money and that we could support our colleagues in the affected countries, be partnering with AMREF and MSF to send healthcare workers, buy equipment, but at the same time as well to support local NGOs that are taking care of the victims. And also there'll be another fund for research, and the research will be much more rooted in health system issues and want to know why this outbreak, the West African outbreak, is different from the previous outbreak of Ebola. Would you kindly introduce yourself?
Sure, yes, thank you very much. My name is Marie Gloriose Ingabire. I'm with the Canada's International Research. See, I got it.
It's fine. Can you repeat?
Yeah, my name is Marie Gloriose Ingabire. I'm with Canada's International Development Research Center. And first of all, let me commend you on your effort as young and future leaders in health systems, the initiative that you're taking to address the issue. And I like also the approach you're taking, looking not only at the technology, the products, the vaccines, but also trying to understand the issues around health systems research, going beyond healthcare systems, and understanding, hopefully, what are the social determinants that actually brought up the crisis, what are the power dynamics behind that.
That's right.
What it's going on that we're seeing, that communities are not engaging or in some cases not collaborating in terms of addressing the crisis. So I think that's really critical. I understand the need for a very quick, short-term humanitarian support and in addressing and trying to actually help our sisters and brothers who are currently facing the issue. But also, let's look at a long-term solution so that we're prepared to address another Ebola crisis or a similar situation, and really think about what, as Africans, as international community, we should be doing to address that.
Yeah. Thank you so much, and it's because of that, the passion that we have as young researchers from the globe, but particularly as Africans, where we feel like the reality is at home now, we need to do something. What is your perception on the global response so far on Ebola?
Sorry, I missed that.
Your response, the global response on Ebola so far, what is your view?
On the global, okay.
On the global response?
Yes. I believe it's been always great to see the community, the global community, being mobilized and trying to help and address the issue.
Yeah.
But I believe it could have been done better, and I think there are some coordination issues over there. But also, if we could, as one, and I was mentioning the social determinants of health, implying different sectors, different actors, from the policies, looking at leadership, from the health providers, from the pharmaceutical industry, from the communities, from the caregivers, to see what can be done. So all that, in order to address the Ebola crisis, coordination is key. Partnership is key.
Thank you so much.
And there's no way that we can actually eradicate Ebola or any kind of crisis or epidemic like it.
That's right.
Without really working together. This is our collective business.
That's right.
And I think it's critical to see it in that way.
That's right. Thank you so much. And the next question, which is the last one.
Yes.
Now is although it's a global issue, but the reality is that Africa is the one is suffering now. They have to handle with the Ebola issue. So what do you think will be the response, the African response on this issue? Have they done what they're supposed to do, or how best can they provide whatever needed to deal with this outbreak of Ebola?
Thank you for the question. I believe this is a great opportunity for Africa. Let's not waste this crisis. Let's do something about it. The affected countries, but also those not affected or not affected yet. So let's try to put in place mechanisms to address that. There have been many declarations in Africa in terms of investment in health. If we could at least fulfill those already existing commitments, we could make really significant progress to that. We have the Abuja Declaration that many countries are still struggling to fulfill. And this is definitely an opportunity to actually recommit and really fulfill the commitments. There is the case, for example, for the investment and the commitment of leaders within in Africa, policy makers, decision makers at different levels too. So I'm looking also at what are the families doing, the communities, what the health providers, etc. So what can be done to address that? Africa, we're talking about rising Africa currently.
That's right.
That we're having more resources. So what are we doing with those resources?
That's right.
That are it's really benefiting our populations. Can we think about that? We know so well that health is the basic need. Without health, you cannot prosper, you cannot really progress.
That's right.
So if we don't take care of our health, I don't think that economic development that we're seeing will be sustainable at all.
That's right.
So that's really critical. Let's make our population healthy, ensure that we promote health, ensure that we don't leave behind our most vulnerable, that we look at the issues that are affecting our most vulnerable populations, and that the whole development becomes an inclusive development.
That's right. Thank you so much. We really appreciate it. Thank you very much. Starting. Good morning. My name is Janine Uwimana Nicole. I'm from the University of Western Cape School of Public Health, as well as the University of Rwanda School of Public Health. And I'm part of the Emerging Voices. We are currently preparing to launch an initiative on Ebola we call the $1 campaign for Ebola. And the purpose for this campaign is to raise awareness on Ebola, and at the same time to mobilize people to be involved financially or otherwise to fight and control this deadly epidemic. So we are currently trying to get different views of participants to the health system research symposium on their perception on global response and the African response, and what an individual can do to prevent the further spread of this virus. So would you please introduce yourself?
Yes, my name is Tim Evans. I'm the Senior Director of Health, Nutrition, Population, Global Practice at the World Bank Group, based in Washington, in the United States.
Thank you. My first question is just to get your views on what is the global response so far on Ebola. How do you see it? What can you say about it?
Well, the global response is late and insufficient, and I think we're trying to catch up, but very unfortunately, the epidemic has surged ahead much faster than the global response, and so I think that's the primary problem. There are efforts now to try and mobilize, and I think they're in the right direction. The biggest challenge is not simply mobilizing the financial resources, it's also mobilizing the people, the workers, at all levels of the health system that are required to help stop the epidemic.
That's right. So you're saying that the response is not that very adequate. And somehow we are calling it as the West African Ebola. It's in Africa. What do you think about the African response to this?
I think the African response has been varied. I've been very impressed with what's happened in Senegal and Nigeria, where the threat of the extension of the outbreak has been snuffed out very definitively. And I think that's a testimony to strong systems. We've also seen at the same time an independent outbreak in the DRC and again a very good response in that country. And we've seen a massive mobilization through the Africa Union in support of the epidemic in West Africa. And so I think those are all very strong positive signals. I think within the three countries, their systems have simply been overwhelmed. And I think the real challenge in any setting like that is how do you get those systems back on their feet so that they can be functional not only for Ebola, but also for other essential health services that are currently being compromised. So that's how I'd sum up the African response at this time.
So somehow there has been a response, but really as Africans, not only individual countries, since it's a kind of an African, not issue per se, although it's a global issue as well, but what is it, do you think that is the best, so far what we've done, is it best or should we kind of do more?
Definitely do more. But I think the important thing is to recognize that in the continent there's a lot of strength, there's a lot of intelligence, there's a lot of capacity. At the same time, this epidemic exposes weaknesses in systems, in disease outbreak capacity, and I think that there's an opportunity to strengthen that. Not only in the context of the immediate response, but also thinking beyond the immediate response.
That's right. In terms of financial resources and human resources, do you think that Africa is up to the level to kind of deal with the issue?
There's certainly sufficient resources to deal with it in Africa. Africa is growing very quickly, as 5 or 6 of the world's 10 fastest growing economies. And so there is, I think, a lot of economic vibrancy across the continent. I think politically, leaders need to make this a priority and ensure that some of that growth is directed towards strengthening the basic fabric of the health system across the continent.
That's right. Thank you so much. And as an individual, what do you think would be our response, our role in fighting this deadly disease?
I think for an individual, one is to be aware, and two is to look for mechanisms and opportunities to support in a very discreet way efforts towards the response. And that can be through NGOs that are working. It could be writing to leaders and encouraging their governments to play a more active role. It could be supporting some discrete areas of research which are going to give us more understanding and knowledge about what's worked or what hasn't worked, or why this epidemic is as bad as it is. I think those are all things that individuals should be encouraged to think about supporting.
Thank you so much.
Thank you.
That's it.
All right. So when is it?